If sending medication into prison was allowed, we wouldn't have faced such a tragedy.
They took everything, even a single pill if they found it.
Access to healthcare is a fundamental human right. In Myanmar's prisons, inmates not only live in unsanitary and unhealthy conditions, but they have little or no access to medical staff. And now they're not even allowed medication paid for by their families. Hello and welcome to Doh Athan, a weekly podcast about human rights stories from Myanmar. It's brought to you by Fondation Hirondelle. This episode is produced by a Doh Athan journalist. Names and voices may have been changed to protect contributors.
This happened to my brother. He was very young. He was always healthy, and all of it was sudden. Although he was in prison, we kept in touch. What the officers told us on the phone was different from what we saw. We became suspicious.
Nandar is talking about her younger brother, Ko Thiha. She says he was a healthy, happy guy. He was in his 30s and married with a young daughter. He used to be a civil servant, but when the military junta gave guns to him and his colleagues and asked them to perform security duties, he left. He joined the resistance, but he was arrested and detained in a prison in Lower Myanmar. Ko Thiha had a minor digestive complaint for which he took over-the-counter medicine. Prison conditions didn't help this complaint, but his family were able to send him the drugs he needed. That is, until last year, when they were told that it was no longer allowed. Ko Thiha's digestive problems went untreated. Then one day the family was called by the prison and told that Ko Thiha had developed stomach problems, been treated at the prison clinic, and died soon after. However, authorities later claimed the cause of death was something completely different. Nandar was suspicious, and these instincts seemed to be confirmed at his funeral.
At the cemetery, a low-ranking prison guard told us that he had accompanied my brother to the clinic to ask for the medicine. My brother was in good spirits and walked to the prison hospital all by himself without the help of a stretcher. Shortly after that, he said he was surprised to find that my brother had passed away. Our family can't accept this. We believe it's not normal.
The family were not allowed to see his medical record. They had no way of challenging authorities, and they may never know what really happened. But they believe Ko Thiha would not have developed these stomach pains if he'd been allowed his medication. In July 2023, the Prisons Department got a new Director General, and soon afterwards there was a ban on families delivering Western medicines to their relatives in prison. That was reportedly prompted by fears that recreational drugs might be smuggled in. This ban was rolled out at different times in different prisons over the following months, although traditional medicine was exempted. Ko Thiha is a leading member of the Political Prisoners Network Myanmar, or PPNM, which supports political prisoners. He was sentenced to a 2-year prison term for his involvement in anti-coup activities and was released in mid-2023. He says the ban on families sending medicines leaves prisoners in a hopeless situation.
Because of the current ban, inmates have to rely on prison clinics or hospitals because they don't have any medicine. At these clinics, the doctors only give paracetamol, whatever the illness is. This doesn't help all illnesses and often makes things worse. There are not enough doctors or medicines in prison hospitals, so the prisoners feel like they're more likely to die if they go to the prison hospital.
Myanmar jails have never had a good reputation for the care of their prisoners, but activists say the situation has become much worse since the military coup in 2021. Data from the Assistance Association for Political Prisoners suggests that in 2021, 19 political detainees died. The next year, that rose to 22. But in 2023, it increased to 39 people. And in just the first 4 months of 2024, 17 political prisoners have already died. Some have died from injuries inflicted during detention. Daw Thandar's son, Ko Thiha, was one of them. He was her only son. He was arrested by the military last year and sustained injuries from being tortured at the interrogation centre. Daw Thandar says he was denied medical treatment and she wasn't even allowed to send him painkillers, but she did visit him a few times in prison.
My son didn't get the medication we sent him. He didn't get access to medical care. That's why he ended like this. When he died, I felt indescribably sad. When we met for the last time, he looked dejected because he knew he was going to die without access to medical care. He was the only hope our family had. We are still inconsolable.
Wai Mar is in her 20s and joined protests against the military coup. She was arrested in 2021 and, like Ko Thiha, was injured during interrogation.
My nerves were damaged. At the interrogation center, they broke my fingers, rolled bamboo poles on my shins, and beat my head. I had to shave my head because my skull was cracked and it needed 4 stitches. Because I was hit, it damaged my nerves.
She spent more than 2 years in a prison in central Myanmar. Apart from broken fingers and head injuries, the interrogation left her with severe pains in her joints and nerve damage to one leg, which left it semi-paralyzed. The medicines sent by her family helped a little, but these were banned in late 2023 and the symptoms got worse. Wai Mar says authorities also began regularly raiding prison cells in case inmates had somehow managed to smuggle in some medicine.
First, prison guards came and seized any medicine. They ordered us to surrender everything. Then, police and soldiers came for what they called a special check. They took everything, even a single pill if they found it. They did this 3 times in a month.
Article 5 of the Universal Declaration of Human Rights says no one shall be subjected to cruel, inhumane or degrading treatment. Article 25 states that everyone has the right to medical care. That includes prisoners. Even Myanmar's ancient jail manual states that prisoners should get health care and families should be allowed to send them medication. But Myanmar prisoners are not getting their rights. Ko Thiha from PPNM says the laws and regulations no longer seem to apply.
I want to ask if the jail manual is still followed. It says that prisoners should get proper medical treatment. But the prisoners were drinking ginger soup during the COVID pandemic. There was no medicine in prison. The law is not applied in prison currently. Whatever prison authorities say goes. That's the law. And whatever orders come to them from above is seen as law.
Prisoners are not given their rights under the law, and families have no faith that the law would be applied to help them get redress when things go wrong. Nandar is still grieving the senseless loss of her brother.
If sending medication into prison was allowed, we wouldn't have faced such a tragedy and inmates would have better health prospects. A human life shouldn't be lost so easily. There was no reason my brother had to die.
Nandar says that since Ko Thiha's death, their father has suffered serious mental health problems, and they haven't even dared to tell his young daughter what's happened.
She doesn't know that her father was imprisoned and died. We lied to her that he was working very hard, making money and buying lots of snacks. We cannot forget him for a single day. It's just like yesterday. I pray that in his future lives, he is spared from such tragedies. He finds a better next life quickly, and is free from suffering.
Thanks for listening to this edition of Doh Athan. We'd welcome your feedback on social media. This project on human rights reporting is supported by Fundación Hirondelle with the help of our donors. You can listen to our podcast via the Doh Athan Facebook page. They can also be found on SoundCloud, YouTube, iTunes and Spotify. You can also listen every Saturday night from 9 to 10 p.m. and Sunday morning from 6 to 7 a.m. on Voice of America Radio. Please tune in again next week.